Hi, welcome to my fourth video. This video is going to be slightly longer than the last ones because I realised that I have missed quite a bit, so I'm going to just basically fill in the blanks. And you may have noticed that I've gone from a blade 1 to a blade 0. That's because my hair was falling out and it was going to my back and it was itchy and it was going everywhere. And when I say that hair falls out everywhere, it really does fall out everywhere. Saves on beauty treatments though. So yeah, anyway, I'm going to start off with the other symptoms that I had besides my cough that I mentioned in my first video, which was night sweats. I was itchy. I lost loads of weight, loss of appetite, and I did actually go to the doctors 3 times. So the first time I went to the doctors, she did send me to A&E, but she sent me to a different hospital, where I sat there for 3.5 hours with chest pain, and then I finally discharged myself, where they said, we wouldn't recommend you going because you might have a blood clot in your lung. I was like, you wouldn't have had me sitting there for 3.5 hours if that were true. So I went back to doctors again, and he sent me home with antibiotics and some cough medicine, saying that I had an inflamed windpipe. Yeah, clearly didn't work. So I went back a third time, where she sent me to obviously A&E, but a different hospital with high blood pressure, a pulse through the roof, and a temperature that was sky high as well. So yeah, that was that. Also why I went to Coventry. So I originally started obviously in Northampton, but they couldn't do the particular surgery that sent me over. I mentioned that I had a complication where they drained my chest, where this horrible, disgusting pea-like fluid came out of my chest, but they were worried that it was going to reaccumulate, so they sent me to Coventry to have keyhole surgery. However, when I got there, cardiology had spoken to haematology, and haematology said if we put her on treatment like now, then the fluid should go by itself anyway, so that's what they did. So they put me on a shitload of steroids, they hooked me up to a drip the same time every day, they hooked me up to a heart monitor, which I literally had to unplug myself to go to the toilets and stuff like that. I had to drink 3 litres of water a day to protect my kidneys and my liver, which was a challenge in itself, and they measured what went in and what came out. So yeah, that was the preparation for my first chemotherapy that I had in Coventry, where, like I said before, I did have a reaction that literally slapped me in the face like hay fever, and I did feel a little bit sicky a couple of days after, but they didn't send me home with any anti-sickness or anything like that. So also the bone marrow, oh my god, it still makes me shudder even thinking about it, but that was done at Coventry as well. So they put a local anaesthetic in the side of my hip, tipped me on my side, and stuck a fuck off great big needle in the side of my hip and drained what they needed out of it, and took a teeny tiny little bit of bone as well with it. So that was horrendous. Anyway, so yeah, had my second lot of chemo, like I showed you in my last video at Northampton, and they sent me home with a goodie bag. So I'm feeling quite good after my last set of chemotherapy. So they've got steroids, iron tablets, stomach protectors, folic acid, anti-gout, just a precaution apparently, anti-sickness, and some backup anti-sickness, and a chemotherapy book. Yay, goodie bag. So yeah. So other stuff that I didn't mention when I was in there. So they do put the smallest of cannulas in your hand for chemotherapy, which is good. I don't like needles myself, so that was horrendous. Stuff they ask you to look out for. So any redness, any rashes, if the cannula starts to hurt, if you're feeling pretty shitty, just make them aware. So I felt like my neck was absolutely massive, like a bodybuilder's neck. It wasn't obviously, but it just felt huge. It felt really weird. Also, I've got numbness in my fingertips. They do make you obviously look out for that. It didn't happen initially, but it did happen afterwards. So, you know, doing like buttons and stuff like that is a little bit of a mission for me at the minute. Also, not a reaction, but just something that happens. The red stuff that goes in that makes you lose your hair does make your pee go pink, which was interesting. So yeah, that's that. Stuff that I hadn't even thought about. So you are on a pregnancy diet, so no soft cheeses, no raw meats, and I did actually have a McDonald's on the way before my chemotherapy, where she bit my head off because she was like, no takeaways, you know, you don't know how the food's prepared. So as I'm prone to infections and stuff like that, no more takeaways, which are pretty sucky. Obviously no crowded places, and you know, just be aware of stuff really. But how I'm feeling. So I know a couple of you obviously concerned. Don't be, you know, I've got cancer, but I've got this, I'm fine. You know, I'm going to have my down days, but, you know, 99% of the time I'm positive. I surround myself with loved ones. Anyone that's got this, don't be afraid to ask for help. I mean, I'm independent. Some would probably say stubborn, but at the end of the day, I've got a daughter, so I've got to ask for help. You know, I've got cancer, but she comes first, and she always will do. So yeah. Also, it's okay to cry. I've cried a couple of times, even if it's just to release tension. But I have been reading some notes on a guy that has had cancer as well, and his name's Andrew Griffin. And this is kind of what I'm going by in regards to positivity, which is his quote is, "Being brave is not being without fear. It's being frightened but having the courage to go on." So that's what I'm doing, and that's how I'm going. I did have a bit of a wobble. I was just, you know, standing in front of the mirror, getting dressed, and I was like, you know what, fuck this. I feel ugly. You know, fuck it. I feel shitty. But at the end of the day, you know, you've got cancer, but, you know, it's going to happen. So, yeah, perfectly normal, perfectly natural. It's going to happen. So that's that. But yeah, that's how I'm feeling at the minute. So if you've got any questions, don't hesitate to ask. But yeah, that's it. Thank you very much for watching. Take care. Bye.